Sunshine. It's our sunshine.
Hello, I am Dr. Kushal Hippalgaonkar, orthopedic surgeon at Sunshine Hospitals. Today I will be talking about exercises that are required for the knee joint when diagnosed with arthritis of the knee. The most common cause of knee pain after the age of about 55-60 is osteoarthritis, which means the wear and tear of the knee joint. It is an age related process. This condition passes through 4 stages, and the best way to prevent the disease from going from the first to the second to the third and so on is exercises of the knee joint. So, today I will be talking about these exercises which are the most important aspect of treatment of this knee problem. Now, there are 5 basic types of exercises. Let us start with the first one. The first set is called isometric quadriceps strengthening, and for this we are going to place this ball at home. If you do not have this ball, then a towel can be used also, something to be under the knee joint. So, once this ball is in place or the towel is in place, you need to pull the ankle towards you like this and press down on this ball yourself. So, let us go back to the position, relax, yeah. Ankle please, push down on the ball, hold for 10 seconds, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, relax please. So, this completes the first set of exercises. Now, in the second set of exercises, you need to keep this ball under your heel, again move the ankle and foot towards you and make the knee tight. So, let us start over. Ankle, knee tight, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, relax. So, this is the second set of exercises. Now, the third set of exercises are called active straight leg raising exercises. So, for this you need to bend the other knee to this level, about 90 degrees at the knee, and then lift this leg up please, up please, up please to this level, and then again move the ankle towards you and hold for 10 seconds, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, relax please, relax. This is the third set of exercises. Now, the fourth set of exercises are called VMO strengthening exercises, again a very important set of exercises. For this we need what is called a cylindrical pillow. You need to place this pillow under your thighs. So, once this is in place, you need to again lift your knee to this level and move the ankle towards you and hold for 10 seconds. So, let us start that over, relax please, lift please, ankle, hold 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, relax please. So, this concludes the fourth set of exercises. Now, the fifth set of exercises is called dynamic quadriceps strengthening. In this ball will be placed in between the 2 knees, and you need to press on the ball first, followed by which you need to raise one leg up, and then move the ankle towards you and hold for 10 seconds. So, let us start over. Ball, press, 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 raise, ankle please, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, relax. So, this concludes the 5 set of exercises for the knee joint. Now, the important thing is that each set needs to be done for a start a minimum of 20 times in the morning, 20 in the afternoon and 20 in the evening, and slowly this needs to be progressed to about 30 or 40 times during each session. So, as I said, knee exercises are the most important factor which prevent disease progression of arthritis and will keep you comfortable with your existing knee pain. Thank you.
Sunshine. It's our sunshine.